Risk and reward. What risks are you taking to try and elicit a temporary neurophysiological change in the person you're treating? When we treat patients, we talk about finesse over force, and especially when we teach manipulation and mobilization, the emphasis for us to get across to the students is it's about skill, it's not about brute force and ignorance. Now, especially when we look at the sort of the cervical spine and the high cervical spine, there's a worrying trend I see across social media of manual therapists from all professions using heavy, long levered traction thrusts to manipulate the upper cervical complex. Now, I'm not going to mention brand names because we were approached to be sponsored and we went no, but I'm going to call it the Jock strap. The reason why I call it the Jock strap is because it's mainly used by, well, you get the gist, yeah? But wrapping someone's head in gaffer tape or straps and then yanking the cervical spine in what is basically high velocity, high amplitude, non-specific thrust is not what I think the way to do an upper cervical technique. That is just brute force and ignorance. For me, I can elicit the same neurophysiological mechanism through a short levered, high velocity, low amplitude, fast and short distance technique with skill, which is gentle, and it's going to elicit exactly the same neurophysiological mechanism, which ultimately, as we know, is temporary. Now, if the effects that I'm going to achieve with this manipulation are temporary, why on earth would I want to put that patient through what looks like a traumatic process? Why would I want to yank that person's cervical spine so hard that they move halfway up the table? It's not worth it. I can elicit the same mechanism through fantastic mobilization techniques, joint mobilization, osteopathic mobilization, this lovely low velocity, low amplitude rhythmical movement. You can get some fantastic results without having to compromise the patient's ligamental structure. So don't be thick, think before you click, right? What I'm saying is it's about risk and reward. If all you have is a sledgehammer, yeah, and you're trying to knock in a nail, all you're going to do is just smash the person. You don't need to do it, yeah? The emphasis is position over power, finesse over force, use the correct technique appropriate for that person. And ultimately, guys, look, we know we're not changing skeletal position. We know we're not changing skeletal structure. I'm not going to pop this joint back into its anatomical position. It's a temporary mechanism. And as it is a temporary mechanism, we can choose gentler techniques to try and elicit the same response. So guys, risk and reward, have a little think before you start employing heavy technique. Boom.